In a healthy body resides a healthy mind. But what if, in the pursuit of a healthy body, we ignore the early symptoms and signs of heart disease? Today on Max Talk, we discuss the brewing culture of aggressive workouts to understand how chronic, extreme exercise training can lead to heart damage and rhythmic disorders. With Dr. Viveka Kumar, Principal Director, Cardiac Sciences, Max Super Specialty Hospital, Saket. Doctor, welcome to the Max Talk.
Hello.
Doctor, the first question that comes in mind is, isn't exercise supposed to prevent cardiac arrest?
Yes, so excess of good is also bad. So exercise has been shown in various studies that people who do moderate exercise, they are the better ones. So if you go beyond that, so it has been seen that if you do train yourself excessively, we call it a different disease which is called athlete's heart disease. It means that if you are going in a realm of athletic performance, training yourself so aggressively and going beyond the moderate stage, then it is harmful in certain people. So therefore, the long term, unless you are compelled to do competing in competitive sports, you should be doing and training moderately so that the exercise is not something which is getting your heart to be stressed out and causing harmful effects.
When we talk about training, specifically weight training, can heavy exercising cause cardiac arrest?
Yes, so if you do unaccustomed heavy exercise, then it is a common cause for cardiac arrest because it would lift the plaque in the heart arteries, can precipitate heart attack. Lifting heavy weight would also increase the blood pressure and can cause brain strokes as well. So heavy weight training is considered to be not good for heart patients. People who are not heart patient and who are trained from the childhood, then it is not harmful. So a trained weight training is good, but people who are not accustomed to that and they started especially late in their life as weight training, especially more than 20 kilograms, then it is harmful.
Also, when we talk about the importance of regular workout, what if someone becomes irregular? What impact does it have on one's health?
Yes, so when we say regular exercise or regular workout, it means that at least 5 days a week of workout has to be there. When you do once in a week or once in a fortnight, then it is an irregular one. And it has been seen that your body would get unaccustomed and then you'll have to retrain yourself and then you don't get really benefit. So if you see the workout, it has to be, continuous workout for at least 30 minutes to 45 minutes to give you benefit. There are studies which have shown that if you do workout for 5-10 minutes in one go and then give a break, and then after same day even if you go for another workout for another 5-10 minutes, then it does not have the same benefit which will have in a continuous 30 minutes or 45 minutes of workout. So irregular workout has been shown not to be good. It does not give you the enough benefit and it may not be really fruitful. So regular, when we say, it has to be people who are diabetic, they should be doing workouts at least 6 days a week. If people who are Indian and diabetic, then there is no break. Every 7 days a week workout is allowed. Those who are having no risk factor, not diabetic, age is not more than 40, non-smoker, no high blood pressure, there it has been seen that at least 4 days a week workout is important. So that's the minimum amount. Below that, if you do less than 4 days a week, it means it is an irregular workout and that's not shown to give you enough benefit.
How do we realize that we have pushed our body to the limit? Are there any early signs and symptoms of cardiac arrest?
So basically, when we say cardiac arrest, it gives you the warning signs. So people would have feeling of fatigue, racing of your heartbeat, or feeling as if you need to sit somewhere. There are certain people who would feel that probably I can push myself further, and in that situation, the patients, if you don't sit or relax, then it will, the cardiac arrest is something which cannot sustain for more than 30 seconds. So that is the time which you have to get recovery from that. So if you don't do that, then the cardiac arrest will happen. So the classical signs would be the panting, severe panting. You cannot really feel that you can take further breaths in. You will feel as if you are not taking support, you might fall down, and the heartbeat will be so fast, and there would be also accompanying chest discomfort as well. So the people would have as if something is bursting within the chest, like a bomb blast within the chest. So these symptoms are something which are very, very alarming, and one has to immediately stop, and not only stop but get a medical help, because this is an early sign. And if you get treated within 1 hour, then the survival is good. Otherwise, as the time passes by, people may lose their lives.
Doctor, since we are talking about exercises, what is the best time to exercise? Is it safe to exercise after meals?
So the exercise has to be, because it's a calorie consuming thing, so the heart will get stressed out. So if you take meal and then you exercise, then meal digestion of the meal would in itself is a process where energy consumption is there. So immediately after that, if you exercise, then it's not good, because the one, heart is doing extra work. Second thing is that immediately after meal, post exercise, certain people might feel nausea and vomiting, and if you vomit your food, then the chances of aspiration and aspiration related complications would be there. And the best time to exercise is early in the morning or in the evening. When you exercise, body releases endorphins, which is a feel good hormone in the body, which also prevents you from going into depression, stress, and other related complications. So the best time is that it should be early in the morning or any time of the day, but not immediately after food.
Cardio these days have become a trend. A lot of people are into cardio, specifically running, cycling, running indoors. What's better? Are there any precautions to be taken?
So cardio is very good, and it's something which increases your stamina. And the reason why it is called cardio, that it is making heart feel better. It increases your peripheral vasodilatation, so the blood pressure also gets controlled. Your heart rate will become lower. So what happens that if you do cardio on a regular basis, it has been seen that the resting heart rate of the person would come down to less than 70. It has been seen that the people whose resting heart rate is more than 70, their complication and death due to the cardiac problem is much higher than those who it has less than 70. So the cardio brings down the resting heart rate to lesser, and also it prevents the heart rate to racing to higher level if the person is exercising. So sudden jump in heart rate is also significantly lesser. And the cardio is one thing which is also helpful in reducing the weight, burning your calories. So if you do cardio on a regular basis, it means not only you are training your heart, also the need for blood pressure medicine will be lesser, the need for diabetes medicine will be lesser, and onset of diabetes and blood pressure can be delayed. So cardio is the best exercise one can do. And if you can add on mind relaxation exercises, yoga, and the stretching exercise, then this combination would be best for the person.
And finally, as we move towards conclusion, what would be some of the safe exercises that you recommend for heart health?
So for the heart health, as we have discussed, the cardio is the best exercise. So any aerobic exercise, be it running, jogging, swimming, or cycling, these are the simple, available, easy, and can be done anywhere in the world. Even if you don't have gym or anything, you can do all these things, and these are considered to be best exercises. Light weights are good, but if you go beyond weight of 20 kilograms and try to do weight training, then it is not good for the heart patients. But those who are not heart patients and are gradually getting trained into weights, then it's okay, they can get it done. The good exercises are the one where you build it from the beginning with the train yourself, and over the period of a week or a month's time, you increase it to 40-45 minutes. So on first day itself, don't stretch yourself to full to 45 minutes or 1 hour. There are people who would on day one would go into this and then get disheartened. So that's not good. So exercise has to be gradual process, and it should be a part of your habit, it should be part of your daily routine, then only it is going to pay dividends.
Thank you so much for this session, Doctor. We hope we could address some of the frequently asked questions on heart health. If you have a question that you would like to share with us, please feel free to comment on our Facebook, Twitter, or YouTube. Once again, we thank you for joining us for this session.
Thank you very much.